Namaste everyone and welcome to this panel on Brics and the Global Health Agenda at the Brics Academic Forum 2021. My name is Shambhavi Naik and I will be the moderator for this session. In the light of what all of us have been through over the past year and a half, the topic for our discussion today really requires no introduction. The experience with COVID-19 has delivered actionable lessons for global health, with one key underlying highlight. Health is a global concern, and as long as COVID-19 lingers in one part of the world, it is a threat to everyone in this world. Such a threat can only be fought through global cooperation. To discuss the lessons learned so far and how BRICS nations can come together for preparedness against future outbreaks, I am joined by eminent colleagues from all the BRICS countries. Dr. Luciana Mendes Santos Servo from Brazil, Ms. Ekaterina Kheifets from Russia, Dr. Chi Xiaoping from China, Dr. Aquina Thulare from South Africa, and Professor Ritupriya from India. I request the audience to post their questions for each speaker in the chat box, and we'll take them after the individual speaker's remarks, or if time permits, at the end of the session. I will now invite Dr. Luciana, who is a researcher at the Institute for Applied Economic Research in Brazil, to present her opening remarks. Dr. Luciana, over to you.
Thank you very much for the invitation to be in this panel. I will address my opening remarks talking about how global health should think and deal centrally with inequities. So we are always saying that we have a lot of territorial inequities in access to health. It is an important determinant of health. And during the pandemic, it became clear for everybody the racial, social, and all the territorial inequities that we have in access to a lot of health, a lot of health systems in the global. As we've seen, the cooperation is fundamental for this. In the case of vaccines, it became obvious to everybody that we need to cooperate in producing, in distributing, and also in getting the population to take the vaccine. So we are not only talking about production of the vaccines, but also in talking about clinical trials that were taken all around the globe. And also we have to deal with another problem, a huge problem, is the anti-vaccine movement. And we have to think how to deal with this problem in a global cooperation. Besides that, we have to deal with inequities in access to healthcare all around the globe. In the case of Brazil, we have a lot of difference in the country in access to health. And it became clear that the access to ICU beds, for example, was a problem, a huge problem to deal with severe cases of COVID. But not only this, we have to think how to coordinate primary healthcare and specialized healthcare to have a good response to the COVID pandemics. Besides that, we are talking about how we are going to prepare and form our professionals to deal with the problems that we have, not having brain drains and other problems that have to deal in the past in the national health. So we are also talking about digital technologies, but we forgot that the digital access to digital technologies is not the same around the globe and not even in a country. So we have to discuss also how to talk about teleconsultation and telemedicine and other things that the COVID pandemic brought to light, but that is not accessible to everybody in Brazil, for example. That's my first remarks. I hope to have a fruitful debate with my colleagues and the participants. Thank you very much.
Thank you, Dr. Luciana. I just wanted to ask you about the inequity that you spoke about, and not just in terms of capacity building, but also coordination, how to adopt digital technologies. What do you think have been the key three challenges that Brazil has faced in combating COVID-19?
We have a lot of investments have been done quickly in ICU beds. So we have campaign hospitals and things like that, but we have problems in coordinating primary health care with this specialized care. And besides that, we have the problems of the preparedness of our health professionals to deal with the pandemics. We expect that the professionals respond as quickly as they respond in a routine way, but the pandemics brought a lot of challenges, even for the protection of health professionals and the organization of the health system to this preparation. Besides that, we have a lot of problems in dealing with the current burden of disease problems, like population was not looking for services because they were worried about getting contaminated. So we have a lot of health problems that will continue and even being aggravated after the pandemics. So besides working with the problems of the pandemics, we'll also have to debate the preparation for the dealing with like maternal health, child health, vaccination of child, or taking care of cancer patients and other patients during the pandemics and after the pandemics that can be aggravated.
Right. I think that just broadly sets the agenda, right? That when you speak about global health, we have to think beyond COVID-19 and infectious diseases. And while I said in my introduction that COVID-19 in one part is a problem elsewhere, even non-communicable diseases are something that have to be addressed through global cooperation. And I think the point that you just made about health problems being aggravated is something that we are bound to see across all the BRICS countries. And therefore, cooperation on that front as well would obviously also be welcome.
Yes, I think this is quite important.
Thank you, Dr. Lucian. I'll come back to you with audience questions a little later. Next, we have Ms. Ekaterina Kheifets from Russia, and she's from the Department of Economics and Social Development, Center for Strategic Research in Russia. Ms. Ekaterina?
Hi, this is my first Brics academic forum, and I would like to say that I'm very honored and grateful for the opportunity to engage in conversation with such talented and intelligent people. So the emergence of the COVID-19 has devastated economies and caused unprecedented challenges to the healthcare systems and global supply chains around the world. Globally, millions of people have ordered to stay at home as a result of lockdowns. Moreover, over 4 million of people have died. The human and economic cost of the pandemic extended far beyond the direct impact of the coronavirus, including death and illnesses resulted by the disruptions in the healthcare systems, as well as unemployment and poverty at a massive scale. The pandemic has overwhelmed healthcare systems around the world, having a knock-on effect on the diagnosis and treatment of other diseases. Many people have avoided seeking for help for other health problems rather than COVID. Because of the lockdown and repurposing of the healthcare resources. Even in diagnosed cases, treatment for diseases and conditions such as cancer were postponed. Other infectious diseases such as malaria, HIV, and tuberculosis were put on the sidelines, even being very real problems for some vulnerable and underdeveloped countries. The pandemic, with its companion of economic and social crises, has produced spikes in anxiety, depression, and other mental health challenges. Isolation can have significant impacts on health outcomes. The development of vaccines for COVID-19 has been a powerful demonstration of how public funding, intense focus, and unprecedented level of cooperation can help spur innovation to address modern public health problems. To succeed in immunizing billions of people, governments have to engage with communities and building trust. Trust both in vaccines and the institution responsible for their vaccination. They need to promote confidence among the public in the effectiveness and safety of the vaccines, as well as the capacity of governments to manage and to manage the logistical challenges of vaccine production. Successful vaccination campaigns require extensive and well-managed engagement with the community. All population groups need to be involved in the design and implementation of initiatives that will build trust in vaccines. So mainly that's my opening remarks, and I would like to answer any of your questions.
Thank you, Ms. Ekaterina. Agatha, I think you spoke about a really important point here, which is on public trust. And I think everyone has tried to develop public trust. In the face of a pandemic, it's obviously there's been a difficult time for everybody. Uh, and lockdowns have not helped the situation at all in terms of frustration. You spoke about mental health, which I think is a really critical point in again for cooperation across the globe on how we're going to tackle this, because it is something we are going to probably see everywhere. In your opinion, what are the key mechanisms of developing trust, particularly on something like vaccines? When they have come in the pandemic, they have come quickly. I mean, it's a great scientific endeavor to get the vaccines out so quickly, but obviously, building that trust is also that other key component to make sure that vaccination drives are successful.
Yeah, absolutely. By saying that the vaccine was developed very quickly, and it's kind of magical and scientific breakthrough. I think that the main mechanism of building trust with people and communities is to engage in conversation. You don't have to make them do the vaccine. You have to explain and engage and answer their questions about the possible effects of COVID-19 vaccine. You also need to listen to the private sector healthcare specialists, because they have a lot of their patients are also wondering what are the effects of the vaccine. So I think that the main mechanism is building a dialogue with communities, and especially with people who are questioning the vaccine and the production of the vaccine. So mainly in dialogue.
Thank you, Mr. Katyan. Siyana, if I can come back to you, I just wanted to ask you as well, did you see any similar problems in Brazil when it comes to trust in vaccines?
Yes, we have seen this as the anti-vaccine movement is a global movement, and you have the social network that spreads quickly news, and fake news we're having problems with this in Brazil, and the trust in vaccines and the problems that vaccine can bring. So besides building trust, I think it's quite important to organize coordination, international communication through all the organizations, all the countries, to say what we can trust about the vaccines. We are building the natural history of this disease, so it's quite difficult to get trust in a movement that is going on. But I think to coordinate a national movement, a international campaign that is coordinated between nations will bring more trust through social networks also.
Indeed. Thank you so much, Dr. Luciana. I would like to invite Dr. Chi Zhaopeng, who's the Deputy Director for the Center for Global Public Health, the Chinese Center for Disease Control and Prevention, to make her opening remarks.
Okay, good morning, good afternoon, and good evening. And ladies and gentlemen, and it's my great pleasure to join Brics Forum and share some of the ideas about Brics Health Cooperation. And the influence of the Brics countries in the international arena has risen enormously in recent decades, not only in the economic and population aspect, but also in the health domain. And because of the high disease burden of Brics countries, we have to deal with a lot of health issues and face tremendous challenges within each country. And at the same time, we also have the responsibility to contribute to the global health work and provide the proper solution for the global health threat. And the COVID-19 pandemic has exposed lots of global health issues, such as the implementation of international health regulation, global public health schools accessibility, health equity, limited resources, and so on. So I think it is the right time for the BRICS countries to work together and develop some joint actions. And in 2020, BRICS STI framework program has launched a call as a response to COVID-19 pandemic for multilateral, basic, applied, and innovation research projects, facilitating cooperation among the researchers and institutions with at least 3 Brics countries. So together with Russia and Brazil, we successfully applied 2 projects about the drugs and epidemiology modeling of COVID-19. And then this is the first time for me to join this concrete project application within Brics countries. I found there are a lot of complements with each other, such as for the modeling construction. We use a variety of models to predict and simulate COVID-19 pandemic at global, country, and city level. It is really a perfect combination. And I do believe that the joint solution for health issues in Brics countries will make a difference for the world, since they are verified in a large country with a large population, and its adaptability and representativeness will be better. Finally, I think Brics represent a group of countries with great potential to move global public health in the right direction. And this Brics Forum provide the best opportunity for us to communicate and work together, and look forward to the fruitful meeting. Thank you.
Thank you, Dr. G. Priti, you touched on a very important point on cooperation of researchers for fundamental research. And this, I think, again, spans across the health field. It is not something that has to be or should be COVID-19 related. If I were to ask you what would be like the 3 areas of health research you would like the Brics countries to collaborate on, what would those be?
Yeah, you mentioned that these 2 topics, the projects we apply together. As is one is for the multi-level framework for quantitative analysis of COVID-19 pandemic, mathematical modeling approaches, and the other is catechism-based carrier and the targeted delivery system for clinical approved or repurposed anti-SARS-CoV-2 drugs and disinfectants. So I think it will contribute a lot for the COVID-19 pandemic, especially for some repurposed drug, and then it will make a big difference in the future. Yeah, and because the severity of the COVID-19 patient is really the point we focus on. If the fatality rate will decrease, and then it will be just like the influenza. So it is really important that for the Brics program set this kind of projects. Thank you.
Thank you, Professor. Next, I would like to invite Dr. Aquina Thulare from South Africa. Dr. Aquina is from the National Department of Health in South Africa. I invite you to give your opening remarks.
Good afternoon, good evening. Thank you very much for inviting me to be part of this prestigious panel. It's not my first time that I'm in a Brics academic forum think tank. I was in Goa, and I also participated in Johannesburg. So I'm the older person in this meeting. But I just wanted to indicate also, like my other co-panelists have said, that the pandemic has resulted in massive disruptions within healthcare as a result both of the infectious disease outbreak, but also indirectly because of public health systems and measures that are inadequate to mitigate the transmission. And this is also as a result of deficiencies in access to quality and affordable health services, and compromising our universal goal of reaching universal health coverage as part of our SDGs, sustainable development goals. The pandemic has placed enormous pressure on the supply side, as my colleagues have indicated, but also we know that vaccination has been identified as a cornerstone for preventing mortality and reducing morbidity from the effects of pandemic. However, as we advocate for vaccination, we know that some of the challenges that countries have experienced, especially countries in the global south, countries especially in the African continent, and I'm sure in some of our Brics countries, the issue of vaccine nationalism, we all know about it. Also, that is very prevalent in many developed countries and has had negative implications for the production and equitable distribution of potential vaccines across the globe. And we also have the issue of protectionism, which has reared its head when developed countries stockpiled on supplies of the vaccine, and whilst other poor countries don't have any vaccines at all. And then my colleagues have also made reference to fear for vaccination, lack of confidence, and for many reasons that they have advanced, we know that the vaccine was produced at a very, very rapid pace, and the population is not confident that the vaccine is safe. We have seen incidences where there have been side effects that have been documented, but it needs, the whole scientific community to rally around and make sure that, we create that confidence in the population. We also have a situation where most of our countries, Brics countries and Global South, lacking health information systems, digital health, that is quite critical and has been shown to be at the corner of making sure that we manage the pandemic quite effectively. Of interest is that, if you look at the Brics countries, we know that Russia and China are ahead in terms of vaccine production. The Sputnik viral vaccine, we know that China has developed Sinopharm and Sinovac and other vaccines. India, to some extent, through the Bharat Institute Biotech, they've developed Covaxin. But if you look at Russia, South Africa and Brazil, we are not at this pace as well yet. And that's why we need to go back to the resolutions of the Brics, the 10th Brics Summit, where ministers and ourselves as the think tank had advocated for the establishment of a Brics Vaccine Research and Development Center. And we know that China and South Africa are already in discussions. They've identified institutions that would work on advancing this Vaccine Research and Development Center. And I think we need to think about this very, very carefully as we move forward. The other area that I think we have collaborated very well on, it's where India and South Africa, and now joined by many, many countries at the WTO, advocated for a TRIPS waiver on intellectual property for the production of vaccines. So it's another area that we need to look at. And then also in the area of digital health, we need to look at best practices, what has happened in some of the Brics countries. I know that Russia has been focusing on its efforts on the use of early warning and tracking systems, the use of surveillance technologies to counter the spread of the virus, and improving low levels of digitalization in the country as well. China has applied a great number of digital tools as well, and we need to learn from that, such as epidemiological indicators, analysis platforms, drones, robots, mobile apps, etc. South Africa is trailing behind, but we are looking at various strategies, such as the electronic vaccination data system, where we are tracking people who have been vaccinated to make sure that they come for their second dose and they are registered appropriately and we can document them. And in terms of, finally, just in terms of collaboration, we must increase our investments in scientific research, undertaking comprehensive and coordinated health system strengthening by improving our infrastructure equipment. We must also look at global and multilateral solutions in vaccine development, such as with the proposed Vaccine Research and Development Center. We must also focus on the importance of data and science to build more resilient health systems, and digital health to look at timely detection, assessment, and analysis of epidemiological data, including looking at laboratory results and on genomic sequencing of the variants that are emerging on a daily basis. And we also need to look at these solutions carefully to create opportunities for revolutionizing access to quality healthcare and bridging many difficulties and enabling our BRICS countries to resolve more global health issues, such as was done with the TRIPS waiver and vaccine protectionism and nationalism approaches that we are trying to mitigate with the Vaccine Research and Development Center. That is my submission for now. Thank you very much.
Thank you, Dr. Aquina, for really painting the picture of how data-based and research-based healthcare within BRICS can look like and should be what we should aim to achieve. Particularly this idea of the BRICS Vaccine Research and Development Center, I think is very exciting because we also face a number of diseases beyond COVID-19 for which we can work together to create vaccines and alleviate those diseases. And the increase in investment in scientific research is also something that we can all obviously work on. I don't think any enough of funding for scientific research is enough anyways. I wanted to ask you a question on the genomic surveillance bit that you just brought up. So obviously we are seeing that genomic surveillance of new variants is extremely important. How important do you think it is for public health agencies to then work on that genomic surveillance and create public health measures? Because there seems to be some disconnect in that linkage. So there are countries which are actively surveilling, but we are not always seem to be prepared despite having information of emerging variants coming in.
I think genomic surveillance is very, very critical because we know that, most of the waves, whether it's the second wave or the third wave or the fourth wave in various countries, has come about as a result of new variants. And what one would want to say is that we need to sequence as early as possible, especially once we know that, a variant has emerged. In our different countries, we need to have that capacity to sequence very, very early and before, the variants, spread widely. And what I think is also important is that we need to collaborate because the skills required for genomic sequencing, the techniques and all that, may not necessarily be present in most of our countries. So there needs to be collaboration and support so that those countries that do not have so many resources that can enable them to sequence can be supported. In our country, for example, we are collaborating with the Africa CDC to make sure that we even support neighboring countries in SADC, in the AU region, so that we all are able to identify the variant of concern that is prevailing at that time. So I agree with you, it's very, very important.
Thank you, Doctor. And finally, if I can have Professor Ekaterina, who's from the School of Social Sciences, Jawaharlal Nehru University, India, to present her opening remarks.
Thank you. Thank you to the organizers for having me here. It's been very interesting listening to my other colleagues, and I'm completely with them in the disruptions and the inequalities and iniquities that we have experienced and suffered in the last year and a half. But I won't go into that very much since we've already gone into that and we all share that experience. What I'd like to talk about is the learnings from the responses that we've had. And clearly the COVID pandemic has highlighted the significance of public health systems, the continuing salience of national boundaries in administering our public health systems. So while we go global, we need to recognize our own national limitations as well as building capacities. It has also shown the resilience of urban, rural, and indigenous communities. In such a time of crisis, they have come forward and risen to the occasion to protect and support themselves and their neighbors, even at a time when social distancing, physical distancing is what was prescribed. And at the same time, we have seen that the international agencies and international cooperation networks have not performed as well as we expected of them in a crisis like this, despite some of the preparedness efforts that had gone in. The delayed information flows, vaccine nationalism, some amount of hoarding of vaccines and PPEs and so on by various countries across the globe have all shown us the need for much better cooperation. The field of global health research too needs to be reviewed for the knowledge content. It very often seems to have, in the health system sphere, failed governments when they needed its inputs the most, including the initial kind of modeling that came to our countries. The laboratory and vaccine R&D have gone off very well. IT contributions have been very welcome and need to be appreciated. But health policy related inputs for COVID were too narrow and reductionist from our very own health systems researchers and ignored critical areas and indicators, thereby not contributing to a robust enough pandemic response. So that's where we need to put our energies. The most effective responses of prevention and treatment came at the primary level and by public systems, following principles of the primary healthcare approach, egalitarian, grounded, shoe-leather public health of the workers on the ground for contact tracing, isolation, primary treatment, home care, building up innate immunity and active immunity. All of this finally happens at the ground level, close to people's homes. And that kind of primary health care has thus once again demonstrated its worth. The Astana Declaration in 2018 had stated that there can be no universal health coverage without primary health care. The COVID pandemic has again brought this stronger home, with agencies such as the World Bank also recognizing, and it brings out a document titled Walk the Talk, Reimagining Primary Healthcare After COVID-19. So I would put our Brics countries coming together to also enhance our capacities at that ground level. We seem to be moving through the globalization process also in our healthcare systems, certainly in India, towards a privatization process which tends to not give strength to these primary level systems. And our Brics countries therefore need to strengthen their own public health capacities at grassroots level as suited to our own societies and communities. We must recognize the role of civil society in creating the last mile link of the communities with the formal systems. And in order to do so, our governments must prioritize a bottom-up flow of knowledge. The knowledge will certainly come from the modeling and the vaccine and the virology labs, but there's also knowledge at the ground level, which needs to be brought up to be able to bring the two together and thereby implement and put in place these technologies where they need to be. In order to do so, the flow of knowledge systems has to be from a bottom-up flow, acknowledge the role of bottom-up knowledge in our health systems research and design of programs, plans, policies, priority and funds to health systems and policy research is something that today must be prioritized with pandemic preparedness as one of the components of it very centrally. And this can be a big step forward where we all come together as Brics countries and governments can cooperate on health systems and policy research in a bigger way than we already have been doing. With the bottom-up knowledge process as well, the local can become meaningful and meaningfully contribute to creating a wholesome global public health instead of an iniquitous global public health agenda that will provide resilience in the years and decades to come. I'll stop at that for the first round and any questions that you may have.
Thank you, Professor Ekaterina. I think you brought out very beautifully the paradox of COVID-19, that it has affected everybody. We have got knowledge being generated at every rung of the ladder. We have just not been able to collate it, and we have not created the channels to have knowledge that has been created at the grassroots to be absorbed, understood, and then given out at a national level and at an international level. And like you very rightly pointed out, a lot of the bigger multilateral sort of agencies have faltered because probably just because of information overload or to some extent, and not being close enough to the ground situation maybe. But how do you then situate BRICS as a collection of 5 nations as opposed to a single country alone in cooperating and making sure that technology, that information flows are going efficiently enough, at least for these 5 countries to work on COVID-19? Do you think smaller multilateral groups work better than a bigger global one? Sorry.
Sure. I would certainly think that all our countries put together have a lot of expertise in the various areas of public health where we need knowledge and information to grow. And that has to be from the, as I would emphasize again, from the community knowledge and the social science knowledge that needs to inform, as well as the virology and the mathematical modeling and the vaccine R&D. And bringing these together would be the big challenge. And I think if we can put our heads together to more holistic kind of public health, rather than the direction that, to my mind, unfortunately, global health has taken, which has been in silos. The mathematical modeling happens with one group, the community and social dimensions are that by another group, and the vaccine production and its dynamics of chains and so on is a third entirely different one. How do we bring them together? Is both a theoretical exercise looking at complexities of systems, and that complexity theory has to underlie the kind of work that our countries can do together. Complexity adaptive systems is something which is well recognized in global health, and yet we're not able to put it into practice, either in the research that we've done up till now or in the way we plan and do our implementation. So my plea would really be for coming together to do complexity-informed public health research, which can then actually be of use to the rest of the world as well. And we take up this challenge of addressing the complexity to its fullest, from the local to the global level. Our countries together certainly have that capacity and know-how to do that.
So breaking silos, I think, is your biggest advice. How do we break the silos? That's our biggest challenge currently. I'm just going to move over to some audience questions now. So I think, Dr. Aquina, this one is for you. How far will the TRIPS waiver proposal that has been tabled at the WTO aid in increasing access to vaccines?
I think it will contribute to some extent to aiding, access to vaccines. But I think more needs to be done, because it's more around the intellectual property, but there might be limitations in terms of the spreading that to more needed goods and services also that are protected by TRIPS. So I think it's a good starting point for collaboration. I think after the proposal was made, more countries felt that they had to support the proposal. But I think we need to have more waivers on a lot of other products that are needed for managing the pandemic. And not just this pandemic, but also other conditions that we have talked about, whether it's conditions that are related to the forgotten illnesses that no one is focusing on at this stage, or the other areas, pharmaceuticals also that might be necessarily needed for managing the pandemic. So I think it's a good starting point, but we can do better.
Sure. Thank you, Dr. Aquina. Any of the other panelists want to add in something? I'll go to the next question. While vaccination for COVID-19 has been developed at a faster pace due to the impact in Western countries, there are other infectious diseases where neither the same speed nor investment is seen as they are localized in parts of Africa or Asia. How can the BRICS cooperate to overcome this gap? It's an open question to everyone in the panel.
I think when we have a global issue like the pandemics, and that achieves all the Western and rich countries and all the ones that has the capacity to produce, it gives a lot of investment to the production of that vaccine. The problems with these other diseases that they are not spread as the COVID-19, not have the interest in the investment that the COVID-19 has. But I think it's what COVID-19 brings to us is that if you build capacity, cooperation, and investment, we'll be able to develop vaccines to other infectious disease. So you have to deal with this agenda and bring in this experience to light and say, okay, now let's go into invest in this other infection disease, bring investments, bring the research and knowledge to do so.
Shambhavi, I would say that this is also a moment where we've learned, scientists across the world have learned to collaborate and break down boundaries and silos. The scientific community, therefore, has contributed both in terms of identifying the virus and so on, its characteristics, as well as in vaccine research and in drug research in a big way. And I think that is something that should carry forward and build on that further for other diseases as well.
I think that's the reason why, as BRICS, we need to follow through on some of the resolutions that we have taken previously, where we have said that we need to strengthen that capacity to research and come up with solutions for what I want to call the forgotten diseases of the global south. Currently, COVID has not respected boundaries, so it's not a global south problem. But there are other conditions that no one is interested in researching and coming up with solutions. And we as BRICS have to work together with our partners in the global south. Look at countries like Cuba that have come up with a fantastic research and products with very minimal resources, and find ways of partnering with such to come up with solutions for the South and for the forgotten illnesses and diseases. Thanks.
I would also like to add that BRICS may become the greatest platform for exchanging experience and possible solution to the problem of cooperation in terms of vaccine production and drug production. Maybe the creation of a network, international network of laboratories where people can exchange their experience and the data collected in terms to help overcome the gap of vaccine production and drug production. Thank you.
Thank you, all the panelists. If I can just marry all of your thoughts together. Have that vaccine research and development center as a nodal point for coordination. B, we have already started breaking silos. I think a question for the entire scientific establishment is, why have we not done this before? Why wait for COVID-19? We would have all just been so much better prepared if we were always doing this. But we haven't. We can start now. Let's not look back. Let's just go ahead from here and try to work this out. Add-on question I had at this point of time was about mobility of researchers, and what can the BRICS countries, or how rather can the BRICS countries cooperate to ensure that this data knowledge exchange of technology, exchange of researchers, training, etc. Be better? Would some sort of visa system, would some sort of like programs which are in mission mode, looking at certain diseases to begin with, as an example, be a good way forward? What do you all think?
I would just submit again what I had said earlier, that the technology development is one part, but developing systems is another. And there we certainly have to, do research outside the laboratory and do it with communities. And if we can set up some kind of collaborative work for that, that would certainly, then get the technology out to people if we need it. And, an understanding of those who are working with the technology of the ground realities so that then they work better.
Sure. Thank you, Professor Chipu. I'm just going to quickly on to the next question. How can we measure the extent to which BRICS countries are experiencing vaccine resistance by citizens?
And I have some comments for this question. And then, so we realize that there's a lot of survey for the vaccine resistance by the citizens all over the world and even in China. And then we do this kind of a survey. And then, it is really important that you know what is the feedback from the citizen, and then you can give them knowledge how could avoid this kind of resistance. So we also analyzed all the survey data online from different countries, and we find it is the results change periodically, especially at the beginning of the vaccine, and then there's a lot of vaccine resistance by the citizens from most of the countries. But after 2 or 3 months, and then they find that they get the vaccine and everything is okay. So when they do the survey again, then they get the feedback that it is pretty lower than before. So we encourage the institution to do the survey periodically. Then we know the trend and then to give the feedback. Thank you.
Thank you, Roshji.
I think it's also very important to be seen to be transparent and sharing information, because there's so many stories that are out there, and if as role players we don't provide the necessary information that will give people confidence, the population might think that there's something else that we are hiding, and it will perpetuate, the dominance of people who may not necessarily be supportive of vaccination. But if we are very, very honest and truthful with the population and explain what they must expect, then the resistance towards the vaccination may go down. Honesty and transparency, I think, is very, very critical in this instance. Thank you very much.
So thank you, Dr. Aquina. There are 2 parts here, right? We're looking at people who might not take the vaccine at all. So we have that sort of movement as well. But we also have people who want to wait and watch. I think that is what Dr. Chi was referring to, that people want to wait and watch and see as more and more people get the vaccine and there are not enough side effects, then we'll probably go and take the vaccine. So that repeated checks, I think, is very critical when it comes to vaccine resistance for COVID-19 vaccine, at least. Thank you, panel. I'll just go to the next question. How can the BRICS cooperate to ensure that our health infrastructure is better equipped for the 3rd wave?
In the same sense that Dr. Priya has already said, we have to share knowledge. How do we deal with this in our country? How are the best practices for dealing with each of the problems that we're faced with? And bringing in community and experiences in the community is central. Brazil have a lot of experiences of the community organizing itself for vigilance, surveillance, and for even convincing the others to vaccinate. And these experiences were quite interesting and quite effective, more than the government in itself. So bringing these experiences, seeing what works, what are the best practices, sharing this knowledge, I think it's central.
I also want to just reflect on what Professor Priya had indicated around a primary healthcare approach and strengthening our health system at that level. Because we know that without a good community participation, community engagement, good public health containment measures, we are not going to win this battle. So a primary healthcare approach using our communities, making sure that our communities are empowered. What we learned here in South Africa is that you can come up with technologies, for example, on contact tracing. But if ever there is no buy-in at a community level, you will get all the anecdotes coming up that, they've come up with these gadgets, they are tracking you, they are monitoring where you are. So it's quite important that we go back to Alma Ata and Astana and say, what have we said around strengthening our health systems, looking at a primary healthcare approach, but also making sure that we start looking seriously at our human resources, because human resources, we always talk about human resources, and we know that it takes time to develop health human resource capacity. And we need to start looking at that very, very carefully and saying, how else are we going to mitigate against an exhausted health workforce? Our health workforce, I think globally, are very, very tired. And we are not talking about how we are going to mitigate this in future pandemics or in the next fourth or fifth wave of this COVID-19 pandemic. Thank you.
Shambhavi, if I may, just carry forward what Aquina highlighted. That it's also that the communities, there is a lot of psychosocial impact and anxieties because of COVID, and we've all seen the suffering because of that, which need not be as much if there is enough communication about the fact that 80 to 85% it is going to be mild, and so on. And so communicating the whole nature of the disease itself and putting in context even the adverse effects of following immunization. Because, for example, while we may say that it's much safer and the risk of the getting COVID is more than the any kind of after effects of the vaccine, if there is one in my community who gets a serious after effect, then whatever I may say as a health worker will not carry because my direct experience is there. So we need to be transparent, as Dr. Quinn has said, about the fact that yes, there could be in a very small number some adverse effects, or that there is only 50% of decline in infectiousness. So yes, vaccinated fully may get COVID, may get a positive test, and yet will not go on to severe disease. Unless we explain that complexity of the phenomenon has to be communicated to the community. If we don't do that, and only it becomes a kind of victim blaming to say they don't understand and there is a hesitancy there. That hesitancy can be overcome only with transparency about the nature of the problem. And for that, we'll have to engage with the communities. For that, we'll have to have people out there. Mass media, of course, will do its job. But we'll also have to engage with them one-to-one. And for that, the human resources, again, that she spoke of, are so critical. And so if one thing that we could, as Brics also do is celebrate our COVID warriors. They've all been in this 2 years, 1.5 years has been horrendous for them. And they've really worked, beyond the call of duty very, very often.
Yeah.
So, if as Brics we can do that, that itself would be a big thing to come together for.
Yes. Thank you, Professor. Moving on to the next question. Would cooperation in vaccine development be on the existing vaccines, Russia, India, and China, ensuring Brics-wide distribution, or to explore a Brics vaccine for distribution to the world with the developing world as a priority?
I would welcome that idea, and I think it's a great idea. All the ifs and buts have to be got over. Yeah, but it's certainly an ideal that we should keep for ourselves.
And the next question is, what role do you see for cooperation in developing traditional medicines and indigenous knowledge systems beyond the pandemic?
I want to answer this question, and actually, I would like to be a hopeful realist that eventually we will win this battle with COVID. And as a result, our cooperation can result in building an ecosystem, a health ecosystem, which will have modern methods of prevention, diagnosis, and treatment, in which we will be able to respond fast enough to prevent any other pandemics and subsequent threats. Moreover, I think that we should really focus on building a pharmaceutical supply chain which will be resilient to any healthcare crises in the future. Thank you.
Thank you, Ms. Ekaterina.
I think to answer that question, it's part of the kind of flow, bottom-up flow that one was talking about of information, where communities have very, very largely used home remedies, used traditional medicine in all kinds of ways as immunity boosters, as management in the mild phases and so on. And so putting that together through a rigorous scientific process of collating it, analyzing it, coming up with what is really effective and works, or what works to different degrees. We've seen even the repurposed drugs work to very different degrees and at different stages of the disease. So if we can do that for herbal medicine as well, that would be great. And again, I think we have the capacities and that knowledge of traditional medicine so beautifully placed in all our countries.
Yes, I totally agree with you. I think, especially for the COVID-19 pandemic, the traditional the Chinese medicine make a great role in the treatment especially for the mild COVID-19 patients. So I think really it's important cooperation in developing these traditional medicines and the knowledge system. And then we also think that, especially for China, we have this experience and then hope to contribute a lot for this. Thank you.
Thank you, Dr. G. We have a couple of minutes left. Can I have a quick round of closing remarks from everybody? We'll start with Dr. Luciana.
And thank you for learning a lot on this panel. And I think we have a lot of themes for research and collaboration, and I hope we can go forward with them, because I think we have a lot in common, more than things separating us in terms of agenda. And I hope to be cooperating with you in the future. Thank you very much.
Thank you, Dr. Luciana. Ms. Ekaterina?
I would like to thank all the participants of the conference, and I hope that our conversation will be a starting point for the massive research and development, and eventually we will fight back the COVID-19. Thank you.
Thank you. Dr. Chi?
Yes, thank you. I really appreciate and enjoy this conference. And then I think we should emphasize the importance of technology transfer and also the health system improvement to empower developing countries through international collaboration, and then to need to establish the Brics network of this cooperation. Thank you.
Thank you, Dr. G. Dr. Aquina?
Let me also thank the hosts of this conference for allowing us to come and share ideas. I've learned a lot from the input, and I think as we move forward, we need to strengthen our intra-Brics cooperation, because it's only through such platforms that we can also focus on other conditions, diseases that are not a priority, especially for the global north, and that we need to go back to our core founding principles of health system strengthening, looking at primary healthcare approach, because without that approach, we are not going to be winning the next pandemics that are going to be on our shores sooner. So thank you very much, and let's strengthen that platform for research and innovation. Thank you.
Thank you. And Professor Ekaterina.
I'd first like to thank everyone for the kind of inputs that came, and it really became an interesting session. Therefore, also to the moderator and the questions in the chat for all the discussion we could have packed into this 1 hour. I think there's lots of issues that have come and surfaced. I'd like to reiterate the fact of primary healthcare, public health systems that need to be on the ground in much stronger way, and a dialogic approach to public health. How do we build dialogue into public health systems so that they don't only come as top-down processes, but there's dialogue across the various sections of society, the different levels of organization, and across all our countries, so that we can cooperate and build better public health systems and better responses to pandemics in the future.
Thank you. Thank you to all of our panelists. Thank you to the audience for listening in. And thank you to the Brics Academic Forum for giving us the opportunity to talk about these ideas today. Thank you all. And I hope you enjoy the remaining of the Brics Academic Forum 2021.